All right, so today we're going to be working on assembling the anesthetic syringe. So we have a basic setup and the syringe. We have our protective sheet, 2 carpules, a long and a short needle, our topical, and our 2x2 for drying the area. And we have our Typodon. So the first thing we're going to do is assemble the syringe. As soon as you open the package, the first thing you want to do is to ensure that everything is tight. Often on many models, the thumb ring can come loose, so you want to make sure that is tight, and then the finger rest or finger bar as well. Once you've secured everything, you can go ahead to place your carpule. In order to do so, you're going to push on that piston rod to expose or open that window, and put the carpule or cartridge in with the rubber stopper end towards the harpoon. One quick push to engage that harpoon, and then slight negative pressure to make sure that's engaged. Don't pull all the way back because it will disengage that harpoon. So again, pressure, one quick push, and then slight gentle pressure to ensure that it's engaged. Once you've confirmed that that harpoon is in fact engaged, you're going to put on the needle respective to whatever arch you are working on. For purposes of this lab, if you're working on the maxillary arch, you will use a blue short needle, and for the mandibular arch, you will use the long or yellow needle. I'm going to recommend you stabilize your elbows on the table in case you are shaky, and I'm going to screw on that needle. And now the syringe is assembled and ready for use. So now we're going to get ready to dry the area, apply the topical anesthetic, and transfer the syringe. So you're going to lift up into the vestibule. We're doing again here a maxillary injection, so I'm going to dry the mucosa there, and we would apply the topical. In order to not make a mess of the Typodon, we will ask that you keep it here and go ahead and place it there. At that point, you're going to verbally tell us that we would leave this on for a minimum of 15 to 30 seconds and a maximum of 1 to 2 minutes. If it's left on for beyond that 1 to 2 minutes, it could result in gingival sloughing, where the gingival tissue actually starts to break down from that topical anesthetic. We will then get ready to pass, making sure that we are passing below the patient's chin and never over their face. When I do so, I'm going to loosen the cap into my palm, and once the operator has it, I'm going to open my fingers, staying still and holding the cap. I'll drop the cap on the tray. The operator will return the syringe to the tray, and I will do a single-handed scoop technique to secure the cap back on. When you're securing the cap, better to grab near the needle hub rather than the top in case the needle was bent during use. Now we're going to get ready to change the carpule. When you're doing this, it's very important to keep note of a few things. We're going to pull back, allowing that to free from the cartridge end of the needle. I'm going to push here, removing my carpule. If the stopper gets left behind, which does happen occasionally, I'm going to take my cotton forceps and pull that right off. Okay, that will happen, and that's okay. So now I'm going to open that window again, pulling back on the piston and going in rubber stopper end first. I need to be very careful because I do have that cartridge end of the needle there that I want to make sure does not get bent. If it gets bent, it will not allow the anesthetic through the lumen, it will not come out of the syringe, and it will also make for a difficult removal of the needle after. So I'm going to gently guide that on. One quick push to lock in that, engage the harpoon. Quick negative pressure, again, not pulling all the way out because it will disengage, and then put on my cardboard needle sheath. At that point, you can put it down on the tray. We will just check that your harpoon is in fact engaged, and at that point, we'll let you know that it's time to disassemble your syringe. When you are disassembling your syringe, the needle comes off first. You want to keep your fingers on this end of the needle sheath and not here. This area is where the cartridge end of the needle is, so applying pressure here, removing the needle, allows us, and we're very susceptible, potentially be stuck by the cartridge end of the needle, so you need to stay on this end here. So we will rotate. It can take a little while, so be patient. Spinning as you see that coming off. And it is out. This needle end in, I've seen people try to go this way, and obviously we don't want to do that because we could get stuck. So sharp end into the sharps container, pushing here, This would get discarded in medical waste. I'm going to remove my carpule, which could also go in medical waste unless it was cracked or broken, when at that point it would need to go into the sharps container. And that is what you'll be responsible for the lab. Again, we will let you know if you're working on the maxilla or the mandible, and you will take and put on the appropriate needle for the arch that you are assigned.